Here's some final tips on having a sliding scale in your private practice. In addition to having an equitable process, you want to be sure that you charge a cash rate fee that covers your living expenses, your business expenses. You need to take care of yourself first before you do your sliding scale. Your sliding scale should not account for more than 10-15% of your caseload size. So for example, because I'm terrible at math, if you had 10 clients, one of those could be sliding scale. So out of 20, 2 of those could be sliding scale. The alternative is to factor in the amount of sliding scale that you want to charge and then raise your private practice cash rate to compensate. Because at the end of the day, if you're doing a sliding scale fee and you cannot feed yourself, that's not okay. We want you to set a fee so that you can do this work and love it and do it without burnout and get great clinical outcomes while taking care of yourself. There's nothing wrong with taking care of yourself. We recommend that you don't start offering your sliding scale fee until you have learned to fill your practice and that you know how to manage and maintain your caseload and you figured out what really is a good caseload size for you. A lot of the times people start out their private practice offering sliding scale, then they burn out and then they have to go back and fix it and it's very stressful. When they put the sliding scale in place, it was to avoid having the hard conversations that they eventually have to have about their fee. Again, we don't want you offering a sliding scale fee if you can't cover your own rent, your own food. And if it's feeling like a struggle, then something needs to shift in the practice or something needs to change that doesn't oppress you further. I really recommend having a time limit to the sliding scale or at least an amount of time for you to come back and assess if the sliding scale is still necessary. Some therapists like to be able to offer, 10 sessions to every client that comes in through the door. And this way, more people get an opportunity at accessing care. Okay, that's my tips for sliding scale in private practice. You can take them or leave them. But if you have more, please share them. What are your thoughts on sliding scale? Are you doing it ethically? Let's talk about it.